I'm Barbra Sonnen-Hernandez, Ambassador of the National Organization for Rare Disorders, celebrating Rare Disease Day, which is celebrated all over the world. And in Texas, we are doing our Texas Rally for Rare Disease Day, bringing awareness for rare diseases. I was afflicted with Guillain-Barré syndrome, was my illness back in 2008. A day I woke up on February 6th, collapsed to the floor, became paralyzed from head to toe with this debilitating illness that causes paralysis. It's a virus that enters my body, and I was paralyzed from head to toe, unable to speak, unable to see, unable to move. And look at me now, because of treatments, research, insurance. I'm here today to talk to you about Rare Disease Day!
Today is a rare opportunity to focus on rare people with rare diseases. No one chooses a rare disease. Rare disease does not discriminate and has no borders or boundaries. I have witnessed the daily determination these individuals have, with strong family support, expert rehabilitative teams, and physicians, progress, as Barbara mentioned, from complete paralysis to independence. It is a moral imperative for our government, providers, payers, and communities to ensure access to all levels of medical and rehabilitative care. We must provide the funding for research and focus on improving access to care to these rare individuals with rare diseases, the care and access they deserve. Thank you very much.
Barbara lived in the anxiety of the unknown diagnosis for several days. I recognize that many of you have lived in those anxious moments for much longer, and many of you continually live in those anxious moments. Barbara received a diagnosis of Guillain-Barré syndrome. Approximately 11 months after Barbara was first admitted to the hospital, miraculously, she was released home from Central Texas Rehab. She had defied the odds. Intensive outpatient physical therapy and occupational therapy began for Barbara. Initially, we began working on transfers, strengthening, and standing. Eventually, standing turned into walking with a walker, and Barbara was well on her way to independence. This is my and Barbara's story. Together, a journey I have been privileged to be a part of. Rehabilitation therapists, that's physical, occupational, and speech therapists, are in a blessed and unique position to share their expertise with others, often making the difference on whether a person progresses forward or does not. It is often in the hands of a rehabilitation therapist that one's journey to wholeness is realized. I earnestly look forward to a day when all rare diseases are diagnosed timely and can receive life-saving and appropriate treatments with full support from our governing bodies. I implore the 83rd Legislature to support NORD and rehabilitation in every possible way. Thank you.
I looked up in the dictionary before coming today to see what rare means. Not widely known, unusual, and uncommon. And believe me, with us who deal with these rare diseases, that's exactly right. You go to your doctor's office, I have CADASIL. What are you talking about? Are you sure you're not drunk or anything? Because no one's heard of it. That's so frustrating for me and for everyone here, I believe. People all their lives go without a mission or a purpose in life. For over 14 years, I've been an advocate for CADASIL. From that frightening beginning of my husband's diagnosis, when only one item could be found on the internet regarding his rare disease, to directing a nonprofit for that promotes awareness, education, and support and research for CADASIL patients, families, friends, and healthcare providers. I stand up here today still scared as a wife and mother and grandmother and caregiver. Thank you to my love of my life, Steve. Steve has CADASIL and has had 3 major strokes, tons of mini strokes, dementia, and now even short-term memory loss, and he's only 56. I appreciate everyone coming for Rare Disease Day. Together we do have hope.
My mother developed a cough, a persistent cough that lasted for about 4 weeks. Finally, the doctor decided to order a chest x-ray and CT scan, and after having those exams, it was revealed that she had a spot on her lung, which revealed that it was a tumor. The tumor was called Leiomyosarcoma. It's a type of cancer, a very rare cancer. It has about a 10% survival rate for anyone diagnosed with it. It's probably one of the most aggressive orphan diseases that are out there. 3 months later, after my mother was diagnosed, she passed away. In 3 months, the disease had metastasized to her skull, to her left hip, and to her thoracic spine. And I'm here advocating today on behalf of the Cynthia Holmes Foundation for these patients because we have to be a voice for them. And what we need is better research, lab protocols. We need help determining better treatment options, a faster diagnosis for patients struggling with this disease. It could really save a life.
Caleb was born with a rare condition called imperforate anus, or IA for short. I know, who knew you could be born without one of those? In Austin, 1 to 2 babies a year are born with IA. We went to the most experienced surgeon in Texas, traveling to Texas Children's Hospital in Houston. There, his test results showed he had the most severe and rare form of IA and some other abnormalities. They weren't sure what to do with him. His third hospitalization here at Dell Children's, he was borderline septic because he had an aggressive bacterial infection that could only be treated with an antibiotic that was given to adults. We traveled over 1,000 miles to Cincinnati Children's Hospital in Cincinnati, Ohio for Caleb's care. There we learned Caleb had a trifecta of rare diseases. His overarching condition is VACTERL, a rare disease that is an association of various conditions, including tethered cord and IA, both of which are also rare diseases. As a mom, I felt relieved and grateful to finally have found someone who could help our son. I can't adequately express what that means to us, to have access to such excellent care. It means I can be his mom, not doctor mom who has to teach the specialist about his conditions, not nurse mom who has to double check the nurses who are unfamiliar with his treatments, not lawyer mom who has to fight with insurance for coverage, but just mom. We want Congress to hear our concerns. We want experienced medical care here in our home state of Texas. Here in Austin would be wonderful. We want insurance to cover more treatments and therapies, including off-label use and experimental treatments. We want funds for research and new therapeutics. I'm not only speaking for our family. It is in our collective best interest to find effective treatments and improve access to quality care when 1 in 10 have a rare disease. It is in our collective best interest to avoid unnecessary ER visits, hospitalizations, complications, missed days of school and work, and increased disability, all because of lack of knowledge, poor access to care, and suboptimal treatment. We need your help and support. Thank you.
The reason that I'm here this morning is to come by and to let you know that we here in this Capitol have not forgotten you. We have not forgotten the families that are suffering from rare diseases. We're not forgotten any individuals that are going through that situation in their life right now. We are aware of your situation. We are getting educated more and more so each and every day. And we will stand for you, and we will be with you here at this Capitol. Whatever it is that we can do, whether it's an educational campaign to residents of our districts, whether it's ensuring that we have proper funding for research and medical trials to help cure some of these rare diseases, it is our job and our mission and our commitment to you that we will be there and we will stand with you. And just know that moving forward, you will always have a friend and a champion here at the state capitol, and I will do what I can to ensure that you are heard and that you are not forgotten. May God bless you and your families, and thank you for coming to our state capitol today.
Now, I told you I was going to say a couple of stories, true stories. of how one person can change the laws of the state of Texas. I went to a meeting, a bunch of other disability advocacy groups. Several people got up and talked about their issues, and one of them was Deborah. Velo-Cardio-Facial-Syndrome, a rare condition in her family, in her son. And what impressed me so much about what Deborah wanted to do was not to help her son, her family, because they knew what his diagnosis was. But her own struggles in figuring out what was going on with her son led her to take on this effort so that public awareness of Velo-Cardio-Facial Syndrome could spread across the state of Texas, because it's a misdiagnosed condition. So it wasn't about Deborah and her family, it was about the other families. And we partnered, and Deborah, one person, got this bill passed, and there is a public awareness campaign in the state of Texas due to one person. So I tell you these things to let you know that as you come here to listen and learn, as I've listened and learned, take action.
Velo-Cardio-Facial Syndrome is the second most common genetic disorder to Down syndrome, and yet we don't have the same name recognition. Velo-Cardio-Facial Syndrome is also called DeGeorge syndrome and 22q11.2 deletion syndrome. So on the 22nd chromosome, Q leg, a very small microdeletion of material that can affect learning, can affect speech, can affect psychiatric issues, can affect immunological issues. There are many, many things that are affected. And we do have a family here that drove in from Dallas. Also, Heather, can you all raise your hands? Thank you, Heather, for being here. And thank you, everybody, for being here this morning.
In 1985, my second daughter, Elizabeth, was born with a cleft palate and cleft lip. In addition, her feet were twisted inward. So because she had these two issues, in her first day of life, a bevy of doctors examined her to be sure that other things were not going on. One of the many tests performed on her as a newborn was a chromosome analysis. 6 weeks later, the results from this test revealed that her problems were caused by a missing piece of chromosome 18, a condition called 18q-. In addition to the problems that were obvious to us, 18q- was said to also cause a long list of other health issues, including severe mental retardation. Additionally, we were told this condition is very, very rare. There are only 60 other cases in the world. I learned that there were, in fact, no researchers working on or even thinking about treatments for 18q- or even chromosome abnormalities in general. So I enrolled in graduate school in human genetics. I thought that if I were on the inside, my pushing would at least be a little more effective. And I also thought that if I could not get others to do the research I wanted to do, I just was going to have to do it myself. So today, in addition to being president of the Chromosome 18 Registry, the parent advocacy organization, and we have a table right up here, I'm also director of the Chromosome 18 Clinical Research Center at the UT Health Science Center in San Antonio. And of those 60 other families in the world, we know of about 3,000 of them. These are people who want to move from welfare to the workforce, if we just knew what we could do to help them. And they are definitely worth our investment. Thank you all so much for being here, and thank you, Barbara, for inviting me.
Well, I want to thank all of you for being here. That's a hard act to follow, but I'm here to show our solidarity with people who often feel that they're alone. And it's a terrible thing to suffer from any disease, but for many people, the condition is worse because their disorder is rare. Having a disease that is shared by only a few other people brings a host of challenges. Rare diseases take longer to diagnose, and often the treatments are limited. Fewer research dollars are directed at rare conditions, and there are fewer medical experts dedicated to their study and their treatment. And because the economies of scale apply to the American healthcare system, just as they do all others, people with rare disease have fewer options. And all too often, they feel that they have less hope for the future. Yet they suffer no less than people whose disease is widely shared, and certainly they are no less deserving of the best medicine that American technology has to offer. But because of advocates like you, there is hope. The Orphan Drug Act turns 30 this year. Its very existence is proof that progress can be made when good people dedicate their time and their effort to finding solutions just like you. So, because of you, we can say to those with rare disorders, we are with you, we are fighting for you, and you don't have to walk this dark road alone. Thank you all very much, and may Godspeed in this worthy cause. Thank you.
Again, we want to thank the organizations who have been coming out today, supporting and helping us. The Lanier High School Health Academy students over here from Austin. We've got CADASIL organization over there. We have congenital hyperinsulinism for kids from Round Rock. Yes. We've got Livestrong Foundation. Woo! Central Texas Rehab Hospital. Woo!
What's important is that we encourage innovation in healthcare. You know, one of the things that we sometimes have a tendency to gravitate towards is a one-size-fits-all. And I think the thing that is going to help us address some of these medical problems is that, first of all, we need to encourage innovation. We need to encourage the insurance carriers to, very often, you know, they want to fund things that don't work, and why don't we encourage them to fund the things that do work? Because so often in the legislature, we focus in on those things that are common to so many people, and what we need to remember is a lot of times with rare diseases, there are not a lot of people that have them, but for those people that do, they're devastating, and we need to call a special attention to that. Events such as this help us to remember that no matter how different our situation may be, we can come together and support each other in our uniqueness. No matter what we're facing, you're not alone. Texans from every walk of life can come together over an important issue like rare diseases in order to find solutions. And so I want to thank you for being here today. It's my honor to be here. And obviously anything we can do to help you, we're more than willing to do. God bless you. Thank you very much.
I'd like to take a moment between speakers here to introduce my wonderful husband and camera guy here, Carlos Hernandez, who stood by my side every day a year in the hospital. And two special family members that are here today. It does take a family to get us going. And I have two special family members, my sister-in-law, Maria Kaiser, and her daughter, Kathleen Barbanek. Also attending are some of my nurses that I had, a special one out in the group at our sign-in sheet, Kim Marie O'Keefe. She's waving her from intensive care unit at Seton, Maine.
Life does take unexpected turns. I'm humbled to be here. The stories that I've heard this morning ring true with my experience as a researcher for 30 years. So I was at the peak of my career in 08 and 09, again doing a lot of pediatric research, and I started getting sick. And eventually found the right specialist to identify what was going on with me. And this disease, the acronym is MAC, and it's a cousin to tuberculosis. Not too many people are familiar with it. Not too many doctors are familiar with it. So again, that thread that we've heard here today of the unknowns, the unexpected, and the overwhelming feeling of, I need answers. You know, only to find out that there really are no approved treatments for my disease. I have been treated. It's a long course. I was on antibiotics, very strong antibiotics, a chemotherapy regimen for over 2 years. I didn't respond to the first round. And right now, I am off of the meds and yet still having problems. I just want to remind you of the importance, as we've heard today, of funding for research for these rare conditions, getting information out into our medical communities and supporting our researchers. And what's also vital is once we do have funding, that we make sure that we oversee that funding. We've seen some headlines recently in Austin, Texas, which have been unsettling, where we saw some research dollars that were not used appropriately. Because we want to make sure those dollars get to what we need of diagnosis, education, and more research into treatments.
In 1983, our second son, Richard, was born with a very rare disease called biliary atresia. It's a liver disease. It has no known cause. It's not genetic. And at that time, there was no treatment for it. And at his birth, we were told he would live about 2 years. In 1983, transplants were still very experimental. People were not being covered by insurance for the transplants, and families were having to have fundraisers so they could have $50,000 in a bank account before the hospital would take them as a transplant candidate. We fought for our son to have the liver transplant because no one in we live in San Antonio. The doctors in San Antonio were not familiar with where to take him or where to refer him. We had to find those places ourselves, and we had to fight for the insurance company to cover our son. I'm glad that Representative Uresti mentioned the Required Request Bill, or the Organ Donation Act. We were here 30 years ago lobbying for that bill. Now we're going to flash forward to 2013, and my husband Eric, now of 38 years, I had to watch him cry as he had to cut up his active state bar card and retire from his practice and receive a disability check. Because he was stricken about 4 years ago with a disease called multiple systems atrophy. It's also known as Hyperinsulinism syndrome. It is also not inherited, it is not contagious, it has no known cause at this point. There is no treatment, no medications, and no cure. The disease damages the cerebellum and the central nervous system, and it slowly drains away the person's vitality, functionality, and mobility. It leaves them locked in, essentially, unable to move any part of their body, but the cognitive and executive brain function remain intact. Many of the families whose loved one has this disease, loses their income provider, their breadwinner, and their insurance. The wife, if she has been working, actually must quit work to care for the 24-hour, 7-day-a-week needs of the spouse. Now they are out without income and a way to pay for health care. Parkinson's disease affects many of our population, more than MSA. Therefore, millions of dollars of research funding for finding treatments and a possible cure are provided. Those of us who have been affected by a rare disease want the same funding for that research too, right? Right. There is no dollar value amount that can be given to saving one life, right? There are doctors and researchers waiting to do research for this disease, and they need the funding to accomplish this.
You are the warriors, each and every one of you. And I do ask God to bless and watch over you, His favor in your healing and dealing with the diseases that are very unique and that you may have. I ask God to help us deliver treatments for those who are living with these unique diseases. You know, there's over 7,000, and I don't have to tell you this, there's over 7,000 identified rare diseases. Some of these, you know, we've all heard of: hemophilia, ALS, Lou Gehrig's, and some less familiar WAGR syndrome. Combined, these affect over 30 million individuals in America. That's more than the state of Texas. 80% of these diseases have genetic origins, while others are results of infections, allergies, environmental causes, or degenerative processes. 50% affect our children. What these diseases have in common is that they are hard to diagnose. Symptoms can what? Sadly, linger for years and be misdiagnosed. There's often no existing effective cure. That's a difficult proposition for patients who feel overwhelmed when they're trying to navigate their own health care when there's not enough research or support services. New procedures, new pharmaceuticals, new treatments are being made available, one small victory at a time. but then they're very expensive, almost always. One such treatment that's been used is adult stem cell. Adult stem cell therapy have helped patients such as those with MS, leukemia, lymphoma, and other blood diseases. Texas has aggressively encouraged advancements in blazing a new path to assist in the storage of adult stem cell research projects and utilizing adult stem cells. Important gains continue to be made, but they take encouragement and support. I will keep up and work with you the fight to promote these advances. You need to help me in the struggles that we face with the FDA that tries to halt private companies like those that are offering adult stem cells to those with some unique diseases that adult stem cell can help. I presented to Ms. Hernandez a resolution that recognizes today, February the 28th, as Rare Disease Awareness Day in the state of Texas. Thank you. And I would like, it's a page and a quarter, but I'd like to read that resolution if I may. Yes. Whereas nearly 7,000 diseases and conditions that are considered rare by medical authorities in the United States, and each year thousands of Texans are among those whose lives are changed by these diseases, and whereas a rare disease is defined as one that affects fewer than 200,000 people, but even though a specific disease may afflict only a small number of sufferers, as such a group, conditions affect almost 300 million Americans, or nearly 1 in 10 people in our nation. Whereas many rare diseases are serious and debilitating, with a significant impact on the lives of those affected and their families, and more than 15 million Americans have a disease for which there is no specific treatment, and whereas individuals and families who face a rare disease often experience a sense of isolation, difficulty in getting an accurate and timely diagnosis, few treatment options, and problems in receiving reimbursement for treatment. Moreover, those who are diagnosed with a lesser-known disorder often find that they must bear the lion's share of responsibility for raising awareness, as well as for raising funds for research toward a possible treatment and cure. And whereas the National Organization for Rare Disorders is sponsoring a nationwide observance of Rare Disease Day, when patients, medical professionals, researchers, government officials, and companies developing treatments can join together to focus attention on rare diseases as a public health issue. Now, therefore, be it resolved that the Senate of the 83rd Texas Legislature hereby recognize February the 28th, 2013 as Rare Disease Day, and call on all Texans to learn more about this matter of serious concern.
I'll tell you about one, and that was my husband, who before his sarcoma diagnosis was the picture of health. At the age of 38, he was told that his body was attacking him. He was told not only that he had a cancer, but that he had a rare cancer. We were blessed in the fact that our doctor, our oncologist, had sarcoma experience and immediately diagnosed Eric with a sarcoma of the soft tissue. We were blessed in the fact that we live in a state that has one of only 25 sarcoma centers in the entire U.S. at MD Anderson. We were blessed in the fact that the radiologist who treated him was one of the pioneers for the new techniques in radiation therapy to help his case. But even with all of that, my husband lost his battle October 8th, 2011. So imagine what people have to overcome when they don't have all those things in their favor. Imagine what they have to overcome when they go to a doctor who has no idea what sarcoma is, who has no idea what treatments are available. In the 30 years since the Orphan Drug Act was passed, we have only had one new drug for sarcoma, and that was last year. There have been no new advances or new treatments. Sarcoma may be rare in adults, but it's pretty common in children. 15 to 20% of all new cancer cases in a child is sarcoma, robbing us of our future doctors, our future lawyers, our future presidents. And so I stand here asking you to stand with us. I ask that you give purposefully, that you give directly to the nonprofits you have heard today, because when you give specifically to that cause, then you make a difference to that specific disease. I ask that you become an advocate. We all have the opportunity to lend our voice. We all have the opportunity to make a difference. If a 16-year-old child can put down her cell phone long enough to help someone, then we all can. We didn't all choose to be in this club, but here we are. We are a part of a community, but together we are so strong.
The condition that I'm here to talk to you a little bit about, 22q, it occurs in an estimated 1 in 2,000 or as much as 1 in 4,000 births. It's actually the second most common genetic disorder, the next most common after Down syndrome. But I suspect many of you have never heard of it before. And that's true of the doctors and educators and therapists that our children see. Many folks living with this very common, relatively genetic disorder don't get diagnosed until they're adults. And children die. We've had 2 children that we know of in Texas die in the last couple of years. I suspect because they're not getting adequate and appropriate treatment due to the lack of awareness in the medical community. It is challenging because funding is very limited in our state for new expenditures, but there are ways that we can make a difference in terms of education and awareness that may not have any funding implications. It's just a question of figuring out what would make sense, what would help folks that deal with your children and adults with these conditions, what would help them have more information. So I hope that we will work together this session and in future legislative sessions to make a difference, because it really does depend on individuals making direct contact with legislators, telling their stories, and making change.
I'm an elected official. I'm also a nurse. I am also involved with seeing people every day in my district that are unusual or rare. I know of a little boy who has a special kind of genetic dwarfism. He's 10 years old, and he's less than 20 inches tall. He weighs 18 pounds, but he's brilliant. What about him? One of 40 in the world that has ever been identified, and yet his mother carries him around and loves him greater and more perhaps than any other child that is, quote, normal, which I maintain there is no normal. Please know that it's only through people like you and advocates for a cause or for awareness that can make an impact on someone who's an elected official. I know that many, many times you feel that we don't listen, that we're talking heads, that we give vacuous rhetoric in a speech, and that's never my intent, and I don't think it's the intent of most, but it comes across that way. So you need to be in our face. You need to be very vigilant in telling us what it is you need and what you think we can help with, and how you can bring your message to people beyond the rareness of your day-to-day that you're recognizing on this last day of February.
I have a young lady here who has a little boy. His name is River, and he is diagnosed with the diffuse type of congenital hyperinsulinism. This is a very rare disease. It's the opposite of diabetes, and many of these moms and dads have to constantly feed their children to keep their sugars up, to keep them alive. So I'm going to introduce to you our Vice President, Amber Ross, from Buda, Texas.
Hello, I want to introduce you to my son, River. He's almost 3 years old, and he has hyperinsulinism. Most people would look at him and think that he was just a normal, healthy little toddler, but little do they know that This little backpack that he wears is actually his life support. This backpack has his feeding bag and a feeding pump in it, and he is fed pretty much continuously through a G-tube. So he has a G-tube that is like a feeding tube inserted into his stomach. Really, our main goal as an organization is we would like to get a bill passed to make blood sugar testing a standard part of the newborn screen, and also for well checkup visits as well. I know my son, who was born at the Seton Hospital in Kyle, was very fortunate that he was born early. And whenever babies are born early, that hospital has a protocol to check blood sugar. And had his blood sugar not been checked, he could have had a massive seizure or even died. But luckily they checked, and when he was born, his blood sugar was a 9. Normal blood sugar is between 70 and 100, so his blood sugar was almost non-existent. And thankfully they checked and were able to get him fed and hooked up to a dextrose IV, which is pretty much like sugar water, to help keep him stable. I just ask that you help us in raising awareness about this disease, and also getting a bill passed to make a simple blood sugar test part of the newborn screen, because it can also help detect type 1 diabetes as well.
I got information from the National Organization for Rare Disorders that I'm with here in the Texas area, a letter from the President of the United States. I send greetings to all those observing Rare Disease Day. As a nation, we share an obligation to ensure the health and well-being of our people. Occasions like Rare Disease Day remind us that we must continue to harness our creativity and ingenuity to remain at the forefront of medical research and innovation. With each new discovery we make today, we not only move closer to building a healthier tomorrow for every American, but we also pave the way for breakthroughs that will save and enrich lives around the world. As you gather to imagine a disease-free world, I wish you all the best. President Barack Obama. If you're struggling, there is hope. There is hope. We are here. We love each and every one of you. Thank you for coming out today. God bless you. God bless America. God bless our great state of Texas for letting us have this rally today. Be safe, drive safely.